Good morning to all of you and greetings from Jerusalem. I want to focus on two updates. One on the health situation, so both focused on Gaza. One, an update on northern Gaza, and the other one on polio. So on northern Gaza, so we as WHO, we remain and we are actually greatly concerned about the safety of patients, health workers, amid this intensified hostilities and the current evacuation orders, and also very much affecting the hospitals mentioned, Kamal Adwan, Al Adha, an Indonesian hospital in northern Gaza. So we also appeal for every possible measure to be taken to protect civilians, healthcare, including patients, health workers, hospitals, and ambulances. So healthcare should never be a target. So WHO was requested by the Ministry of Health and respective hospitals to support the evacuation of critical non-walking patients from this hospital. We immediately planned this mission. We were requested on the 7th. On 8th of October, we were ready. The mission to Kamal Adwan, that's where the patients would be gathered and they would be brought, non-walking critical patients, they would be transferred. That was the plan to Al-Shifa Hospital and Al-Ahli and a few to Sahaba. So on 8 October, the mission was ready, and those missions are incredibly complex and enormous time consuming to prepare. It's not just WHO, it's with UN partners like OCHA, but also with our counterpart, the Palestinian Red Crescent Society, with their staff and ambulances, CADUs, etc., with a string of ambulances. So 8 October, mission impeded. 8-9 hours at checkpoints, etc., and holding points, mission impeded. 9 October, similar planning, mission impeded, similar reasons. Yesterday, at the 10 October, they passed the checking points, but at one checking point very close to Kamal Adwan, they could not continue, and they had to abort the mission late in the evening. They were back very late in the evening. Other missions from WHO as well to resupply Al Sahaba Hospital, for example, with fuel, blood units, medical supplies, were also denied on 9th October and impeded on the 10th October. We are always ready, and we're still planning now. We are now again planning with the team in Gaza to, when it's still needed, to have this mission to transfer these critical non-walking patients either tomorrow or on Sunday. But we need to be properly facilitated. So as of yesterday, it's estimated there are 19 patients still in Kamal Adwan, 41 patients in Al Adha, and 28 patients in Indonesia. Kamal Adwan and Al Adha remain partially functional. We cannot say that Indonesia is functional anymore. They struggle due to shortage of supplies. So Kamal Adwan, Al Adha, including blood, trauma disposables, medication for patients with non-communicable diseases, and fuel. And the latest report, Indonesian hospital is no longer able to provide services or accommodate new patients. So, and I want to stress this point, Kamal Adwan, Al Adha, Indonesia, were the only 3 hospitals who remain partly functional in the north of Gaza. It lacks in the north of Gaza primary healthcare facilities. We get this report from the hospitals that many other hospitals in the north now are running out of fuel. Most of the UN and humanitarian missions are not happening to the north. They're running out of fuel, specific medical supplies, and we are 1 year in this crisis. And there's a kind of, I don't get it, that we can still not have these humanitarian corridors to make sure that these missions can continue. So we request again, starting to request these humanitarian missions to the north, wherever, to the south, they need to happen. On polio, so maybe a little bit more positive here. The second round of an emergency polio vaccination campaign is scheduled to start on coming Monday, the 4th of October, in Gaza, to vaccinate an estimated 591,700 children. That's the target, under 10 years of age, with the second dose of the novel oral polio vaccine type 2, NOPV2 vaccine. Again, this is similarly organized by the Ministry of Health, together with WHO, UNICEF, UNRWA, and many partners. Vitamin A will be added. I'm sure that my UNICEF colleague will allude to that process. The second round, we will have a similar approach. 3 phases, focusing on 3 zones, the middle zone, the southern zone, and the northern zone, each involving at least 3 campaigns with an extra day for catch-up when needed and a day in between to prepare. Hundreds of teams are ready to populate the fixed and mobile teams will be deployed, community engagement, awareness raises conducted during the campaign. Local teams will be deployed in areas that need special coordination outside the so-called polygon to reach the children, which are not as part of the agreed polygons, and to receive the vaccine as we did in the first round. It's critical that they are reached as well. So once again, a humanitarian pause will be a prerequisite to implement a successful second round, particularly to ensure that all polio workers can operate in a safe, secure environment and community and families can obtain vaccination for children without fear. So we renew our request for all parties of the conflict to implement this necessary humanitarian pauses in Gaza for the second round. Particularly critical as new evacuation orders in the north of Gaza are threatening access to hospitals and protection of health facilities